This project is part of a large research undertaking called Designing Out Medical Error, which is a 3-year project funded by the Engineering and Physical Sciences Research Council and is a collaboration between ourselves, clinicians and psychologists from St Mary's Hospital, and business experts from the Imperial College Business School. Medical error in hospitals is currently a hot topic in political circles and in the media. We've all heard about the awful cases such as at Stafford Hospital, but this is just a lot of media hype, isn't it? Well, the research suggests otherwise. Research indicates that as many as 1 in 10 hospital patients may suffer the effects of error in their care, and more than half of these are believed to be avoidable. But don't worry just yet. Our main aim in this project is to reduce instances of medical error. We intend to do this by firstly trying to understand and map healthcare processes on surgical wards, and secondly, use this research as an evidence base to design new equipment and systems. Hundreds of processes happen on the wards, so to help us identify the most risky ones, we came up with an innovative way of rating them in terms of patient harm. Using a combination of incident data from the National Patient Safety Agency, a staff questionnaire asking staff what they thought the issues were, and ward observations, we were able to rate several processes in terms of risk. So these processes were turned into design briefs, which we are now working on. There's hand washing, infection control, which is preventing the spread of bugs, handover of information between doctors and nurses' shifts, medication, which is drug delivery, and vital signs, which is taking regular observations such as blood pressure. We then went back into 3 different hospitals and got feedback from doctors, nurses and patients on all our ideas, even the slightly crazy ones. This whole process helped to refine the number of initial ideas down to a few more selected ideas, which were the most popular. From there, we managed to whittle these down into the final ideas to take forward. The design in this exhibition is just one of these ideas which we have taken forward. Through observations in the bed space, it was realised that staff were not complying with hand hygiene and infection control protocols because the equipment was usually all over the ward and not easily accessible. Reminders such as signs were also ineffective as they were just ignored or were not clear. One patient we spoke to said, "That's all you see, isn't it? People running from one side of the bed to the other, saying, 'Get me this, get me that.'" Looking at behaviour around the bed was revealing. We noticed that the patient medication locker was often tucked out of the way and hard to reach. There was nowhere for doctors to put their dirty needles and scalpels. Gloves and aprons were stored elsewhere, and that there was no flat surface for staff to use when reading or writing. We realised that if we could position all the equipment they need in one handy place, it would remind and encourage staff to abide by these rules. But what should go on this care station? We surveyed our 3 hospitals, giving them a list of what could go on it and asked them to prioritise the items. There was a general consensus that things such as hand hygiene and infection control equipment were essential, as well as having a central hub for notes and medication. So we got to work on designing the care station, working out how to include all the equipment the nurses wanted. So here's the first prototype. The idea is that all the members of staff interact with the care station as they approach the patients, and it becomes a central hub for bed space activity. It has an apron and gloves for infection control precautions, wipes to clean equipment between patients, an alcohol gel for hand hygiene, a medication locker to securely store patient medication, a sharps bin for safely disposing of sharps, and a flat surface to keep records and provide a working surface. From the initial feedback we have received on the wards, we have found that doctors and nurses really like it, as all the equipment is in one convenient place.
My first impression of the care station is that it's really, you can place it at the right height, so it's really easy for certain people who are tall like myself to get easy access to the equipment I might need, and making sure that I can have my documentation laid out, and certainly access to sort of gels and gloves, which is a useful feature.
Having the hand gel, having the female wipes, even though a smaller female wipes, and having drugs and the aprons and gloves at a handy period.
From here, we intend to test this prototype and refine the care station. We will follow the same design process for the other design interventions. By this time next year, there will be a full exhibition of the final work. For more information, please visit our website.